Hey everybody, I'm sitting here with two very special guests. We're Cullen Wright and Christina Lonigro, and they are with Advocate Health Advisors' very, very cool special branch. It's called VETECare, and that is for us, the veterans. I'm not going to talk too much about it because these two know all about it, and we want to hear it right from their lips. They've been guests on the show before, so we're going to have that episode in the show notes. You can go back into that, but we're going to talk about what's going on up to date. Tell us a little bit about what you're sharing here at the convention. What's new, what's happening, what's going on?
VETECare is our new term.
Okay.
We rolled that out. It's just a combination of veterans benefits and Medicare smashed together. It's totally our word. We actually trademarked it. And the successes just keep on piling on top of each other. When we started a few years ago, we wanted veterans to understand that there are plans out there that can complement your VA coverage. There may be some things that you don't get at the VA. You may want closer, quicker, specialists of your own choosing, outside second opinion. And we've evolved, and we really deal with all three buckets of military health care now. We also work with TRICARE and CHAMP VA. Those pay second and last. And that first payer, most folks start out with original Medicare in that. And we can show them how to take that original Medicare sort of as the funding source. And we use companies like WellCare. And they have these plans that not only do what original Medicare does, but then they add all these great things on that we don't get through TRICARE, CHAMP VA. Some don't get at the VA, like dental, vision, hearing. And they get to the end of some of these, and they even have a little bit left over after they make a nice plan. And you'll see some of the commercials on TV that talk about getting some of your money back. That's where that money back comes from. Because when we give this to a for-profit company, they just sort of mind the ship a little bit better, and they do more for less. The thing that I love about it is it's causing us to detect things earlier, live longer, happier, healthier lives, and avoid misery. And it's just the old adage of prevention versus cure. And we really believe in that here. So I'll stop and let the brains of the operation talk here.
Okay. Well, I think it's most important is that veterans understand they have two armed benefits. They have military benefits, whether it be VA health care, CHAMP VA for those spouses, or TRICARE for life, which could be for both, right? And we want to make sure they know the process, that it's important that they keep Medicare Part B especially, so that they can access some of these additional benefits. And we have learned how to do that, making sure that veterans are getting the right information along with their spouses.
Now, is that even for veterans who are like 100% service connected?
Yes, it would be,
Okay.
because there are still some things that veterans do not receive when they're 100%.
Oh.
And that they don't receive at the VA. And that could be, they do have dental care, they have vision care, but they may not have all the options that they would want to have. For example, implants. We know that some of the carriers will provide implants, and they don't carry that at the VA currently. You may have someone who wants over-the-counter benefits or gym membership. They're not able to get that through YMCA anymore with that relationship, and so now part of Whole Health can include a gym membership plan.
Now, is this something that happens like at an annual enrollment, or can a veteran come and get the combination of these at any specific time? Or
Perfect question.
what's that process like, and how do you guys kind of help support the veteran through this?
Perfect question. You got this season where you can't even watch a ball game for all the commercials for Medicare.
That's right.
But veterans actually have an enrollment period that exists year-round.
Okay.
And it's based on where they get their prescription drug coverage from. There's probably 2 million people almost that have a life and health license in the nation. We have about 600 agents that have received the VETECare certification. And we'll utilize them to talk to the veterans that get those benefits that they know. But they know how to use that enrollment period. And then there's always just enrollment periods that exist. CMS makes a lot of exceptions for things like a disaster or something like that may have affected someone's ability to make an informed decision during the... And that's really our goal. We want somebody to make an informed decision. Very often we'll talk to a veteran and we'll say, okay, look, you're using the VA, you've got a great plan, and there's your first payer, you got TRICARE, you understand how it works, don't change a thing. And then they sort of give us a look. I'm like, seriously, don't change a thing. Here's my card. Don't let anybody call you on the phone and convince you to change a thing. Because if they're not a VETECare certified agent, they may get it right, but I know our folks will get it right because we put them through the ringer on the certification process. They get so frustrated, me and Christine, because they have to make 100 on the certification, and then they can come to events like this. But it is probably the most rewarding, feel-good job you could ever have because it literally saves and changes lives on a regular basis. Christina has an example of a gentleman that was seeing multiple oncologists. Everyone knew he was a Vietnam veteran. None of them were VA doctors, so they didn't really think the service connected. Christina got involved, full 100% permanent total, so now the wife gets some benefits for that. He passed away like a couple weeks later.
Oh, man.
So that was a life-impacting. One of the first guys I ever met, Frank Babbitt, down in Naples, Florida, a wonderful guy, plank holder on the USS Independence when it rolled out of the Brooklyn Navy Yard. Frank was paying $2,400 a month plus over the counter, full retail price for his medicines, because they'd heard about a Part D penalty, but just didn't know how bad it really was. I took him to the VA, got his cost down to $8, and a few other great benefits.
That really angers me.
It's just
On
I
so
don't
many
really think
levels.
there's I don't think there's anybody out there that does things maliciously.
Right, they just
It's
happen over
just-
time. Right, the system.
We've just got a unique opportunity, and I got to give a shout out to our CEO, Darwin Hill. He's a retired colonel from the Army. This is our passion play. He said to me, take your time, learn all 4 systems that you need to know, because you have to know VA, VA TRICARE, Medicare, and more importantly, how they work together, in some cases, how they don't work together. So we've got a very unique opportunity to advocate, and I love what we do. I don't think I'll ever retire.
I feel like a lot of veterans are pretty skeptical because we're one of the most preyed upon communities. So, when somebody approaches like, hey, you should come talk to us, I think when I sat down with you guys, obviously my guards are very up, and I'm like very protective of the veteran community too. So I'm like, when you said you're a veteran and your dad's a veteran and it's a veteran-owned company, I'm like immediately oh god, this sort of immediate exhale.
Thank you. Yeah.
Yes, I think that happens, and then when you hear these success stories, that also is sort of validating too. And how did that make you feel hearing that you were able to come through for that veteran and having such
and probably the countless others that you
I
have,
think
right?
that it really warms my heart, honestly. It's definitely a passion for me to work with veterans and to be able to help them. I just sat with someone today, and he had no idea what he was going to do. And you could see the scared look on his face. He said, why doesn't anybody tell me this? Why didn't I know about having Medicare and that my wife could lose her benefits if I don't sign up for it? And he has TRICARE currently, and he'll have TRICARE for life, but no one told him.
And the military does a pretty good job now when you leave the program. When I left active duty, it was almost like an 18-month phased-in process to get out. That wasn't the case when some of our Medicare eligible veterans were leaving the military. Some of them got to see you, don't wear your uniform home. And it was a disservice then, and it is now too. And that's really where we pick up, because Christina's right. We'll have veterans almost get upset with us sometimes, like not really at us, but they're like, why is nobody telling us this stuff? And I'm like, I can't tell you anything, because me and Christina, we're on the road like 200 days a year trying to tell it as hard as we can. So, which is why thank you for letting us be here too.
Well, we're so appreciative to have you, and maybe a little bit of a fun question, because Christina, your dad was a past national commander, right, of the Legion. So what's it like, coming to the convention? I bet it's almost kind of like a homecoming of sorts. And is there anything that's kind of really stood out to you guys as one of your favorite parts so far, other than the podcast?
Honestly, for me, it is like coming home. I know so many people. I know people on the national level that I've asked about. There's younger veterans that I've been able to say, hey, you need to get involved. And in fact, one of the gentlemen who's with me today, Brandon, he's going to be a member of not just the American Legion, 8 years in the Air Force, but he's also going to join the Sons of the American Legion. So it's so awesome, because I'm able to bring others to that same family. So I love it.
I love that.
That's tremendous.
I like the partnership that we got with WellCare. WellCare has really taken this, because we've seen companies, unnamed, come and go. And this is a great company. They immediately recognize what we do and why we're different. because the thing about if I let you do it, I got to let everybody do it. It's dead in the water when you listen to who we are and what we do, and they did. And I can't say enough good stuff about the relationship so far with the American Legion, WellCare, Advocate, all of us working together.
Well, thank you, Christina. Thank you, Cullen.
Thank you.
Well, they're definitely.
Thank you.
I should say, you look around this booth that we're in right now,
Yeah.
recording this session. They are one of the key sponsors of the convention here and
Yeah.
this booth. So thank you, WellCare.
Yes.
Thank you.
If
Shout
veterans,
out WellCare.
shout out to WellCare. Episode 93 is where we recorded for the Advocate Healthcare Advisor. So if you want to check out that original episode, go back and
great.
listen to that. Also, if we want to find your website, where can Alphas find you?
You can find us at advocatehealthadvisors.com.
Okay.
We do have an area where you can select veterans, and we also have advocateforveterans.com.
All right,
Spell
that'll
that word for.